Hi, I'm Lareli Pineda and I'm here to report about TEACCH strategies. The acronym of TEACCH means Treatment and Education of Autistics and Related Communication Handicapped Children. It is an evidence-based training, programs, research for individuals of all ages and skill levels with autism spectrum disorders. TEACCH is an approach which requires a clear understanding of learners' needs in order to be able to teach them effectively. The TEACCH program is used to promote learning and development, in particular communication and social skills, independence, coping skills, and skills for daily life like dressing, washing, cleaning teeth, and so on. The way TEACCH is used depends on the age of the person involved. For example, a TEACCH program might focus on early intervention for a young child or supported employment for an adult. The key idea is to teach children in a way that makes the most of their strengths and works around their weaknesses. The main focus of TEACCH is on the design of the physical and visual environment. The classrooms are structured to accommodate the difficulties or behaviors of individuals with autism it may encounter while teaching them to behave in appropriate and acceptable ways. TEACCH believes that structured for children with autism provides a strong framework for learning. So the physical layout, featured schedules, and featured work systems are very important. And this is what we call structured teaching. TEACCH is designed to make the most of individual strengths within a very structured environment. Here are the four major components of structured teaching. First is the physical structure. It is the organization of physical environment. The classroom environment is set up and where materials and furniture are placed. It can help or hinder a student's independent functioning and his recognition of compliance with rules and limits. It should be designed to provide students with visual information and to direct their activities in predictable manner. Here are the examples of work area. One-on-one area, small group area, and independent work area. Next is the scheduling. A visual schedule communicates the sequence of upcoming activities or events through the use of objects, photographs, icons, and words or a combination of tangible supports. It tells a student where he or she should be, when he or she should be there, and what the activity will be. After the scheduling, we have the work system. It tells the students what activities must be completed by visually specifying what and how much work must be done and when the session is complete. A work system is an organizational system that gives a student with autism information about what is expected when he or she arrives at a classroom location. These are some of the work boxes for sorting tasks, math tasks, literacy tasks, social tasks, and writing tasks. And the last component of structured teaching is the task organization. It is a visual structure that adds a physical or visual component to tasks to assist students in understanding how an activity should be completed. Next is teaching method. A teacher must be systematized and organized in teaching methods in order to effectively teach students with autism. To help students to function successfully, the teacher must setting up the teaching task. This makes learning situations more predictable and easier for students. It can help to overcome distractibility, resistance to change, and lack of motivation. Next is provide only the material of a students will need for specific tasks. Placing materials in the setting where they will be used can also help a student to complete his or her task independently. Next is use samples or pictures of finished products to show students what needs to be done. Pictures and written instructions can be used to help the students to complete a sequential task in the right order. Next, use prompt. It can be physical prompt, when the teacher guides the student's hands to do the task, or verbal prompt, when the teacher tells the student what to do. The prompt must be clear, consistent, and directed toward the student before he responds incorrectly. And the last one is build a motivation to work. Most people are motivated to work because a combination of praises from others. Students with autism are often not automatically motivated by these things. So, we provide reinforcements like toys, play, stars. Many students are motivated by foods and that they really like. To effectively teach students with autism, a teacher must provide structure to set up the classroom so that students understand where to be, what to do, and how to do it in all as independently as possible. So I have an article here saying that TEACCH program is effectively to the students with autism. The aim of this study was to compare the effectiveness of SIT and TEACCH approaches in children with autism spectrum disorders. Sensory integration therapy is one of the most commonly used treatment and approaches for autism spectrum disorders. TEACCH and education of autistic and related communication handicapped children is another less known approach. On the study, they define autism spectrum disorders as the most severe developmental disabilities, which characterized by abnormalities in communication and social interaction, as well as repetitive and stereotyped behaviors and interests. ASDs are lifelong condition and a high proportion of the individuals. ASD required a lifelong full-time care. The prevalence of ASD is about 1 to 2.5% of children in the general population, and the number of diagnosis cases of ASD has been increased in recent decades. Most children with ASD have unusual behavior in responding to ordinary auditory, visual, tactile, and oral stimuli or sensory behavior. This sensory behavior is attributed to a defect in the processing and integrating sensory stimuli in nervous system. However, yet the underlying mechanism is not fully known. Therefore, sensory integration therapy is one of the most common treatment approaches for children with ASD. In SIT, playing is given to the children in order to improve sensory problem. They also give different activities like being brushed, rubbed, or touched with various instruments, swinging, sitting on a bouncy or yoga ball, or riding a child walker, or carrying some weight or wearing a weighted vest, are used in order to improve the sensory reaction in the child. According to them, TEACCH program is an approach that supports the individual's ability to learn, comprehend, and apply learning across situations. A close cooperation and working relationships between parents and practitioners are necessary in TEACCH programs. The study design was quasi-experimental to compare the effectiveness of SIT and TEACCH approaches to children with autism spectrum disorder. The participants are all children aged 3 to 9 with an IQ normal range who were diagnosed with ASD. They give SIT intervention. In SIT group, for improvement of tactile, they have 60 sessions of different activities, and these are roundabout the wall, roller, child walker, yoga ball, quicksand, tug of war game, sit and take, imitate a dog, bouncing, and chasing the child. They also give a 6-month TEACCH program, which includes children's 1-month assessment on the basis of normal growth criteria, providing the necessary explanation to parents to cooperate with the intervention, preparing a visual framework by pictures or drawing for the children, and after preparing the visual framework, activity cards were given to the children by a routine-specific sequence based on doing a less pleasant activity followed a more pleasant activity, like tying shoelace and then playing computer game. There were some rewards after completion of each task or activity. This training schedule was followed by practitioners and parents at home. This is the result. Table 1 shows comparison of children characteristics and the TEACCH scores at the baseline level. There was no significant differences in the age of children, economic status. The present study was the first study in Iran that compared the effectiveness of SIT and TEACCH, the two commonly used treatment approaches for children with ASD. This study showed that both approaches were effective in reducing autism symptoms as measured by TEACCH. Similarly, several previous studies have shown that SIT is effective in reducing autism symptoms in children with ASD. Also, several studies show the effectiveness of TEACCH programs in treatment of children with ASD with different culture background. This study showed that the effect of SIT and TEACCH were more on children at younger age group. Similarly, the need of early intervention and effectiveness of different treatment approaches at younger age groups have been reported frequently, which shows the importance of diagnosis and treatment of children with autism as early as possible. However, there is no consistency about importance of age in treatment outcome of children with ASD. In conclusion, the main findings of study was that TEACCH program was more effective than SIT program for students with autism spectrum disorder. And that is TEACCH strategies. Thank you for watching and listening. If you have questions about TEACCH strategies, feel free to email or message me.